Hello everyone, my name is Simiran Choudhary and I welcome you all on behalf of Voice of Healthcare on the special series Voice of Healthcare Incubator Visionaries Unplugged. So today we have Dr. Neha Vora, the founder of Onco Connect, and she is here to talk to us about what are the hurdles which a AI-based healthcare company can face. So without wasting any of the time, I'm here with her, totally focusing on the straightforward questions directly from an entrepreneur, that what are the hurdles we can face. So welcome to our show, Dr. Neha.
Thank you so much, Simran.
So Dr. Neha, I know a little bit about you, that you're founder of Onco Connect, a company who is an AI-based healthcare cancer diagnosing company for the employees, right? But I want to know a little bit more about you, from you.
Okay, sure. Thank you so much for this opportunity. So personally for myself, it's been an exciting journey as an entrepreneur. And in the AI space, it's my belief that AI is an enabler. People think that it's a solution for everything, but it's not. So it just helps you to how you can get into the cancer screening place. Cancer is on the rise. There was another article that says that India is going to be the cancer hub of the world, which is not a very proud thing, but we have to take that in consideration and screen as many people as we can to make sure that they either are diagnosed early so that they can get better treatment outcomes, or we are keeping above the cancer to say that we are doing what we can. So that is why we have a cancer screening, early screening for cancer, and I'm the co-founder of that. Thank you.
Thank you so much for sharing that with us. So I have few of the questions which I believe it will come from your experience and expertise, and that will automatically help our audience, which is the aspiring entrepreneurs out there who are, and typically if I have to talk about the people who want to be in this AI healthcare startup, or the companies, or want to launch their brand or be one of the leading companies out there. So you could be a great person to give them insights and expert advices. So if we are focusing on exactly on the hurdles, so my first question would be on this. So what do you think would be all the hurdles, if you can name it, when it comes to AI-based healthcare companies? And since it's a very rapidly growing sector, right? So how does a person to keep these space in mind, the changing technology, and like you said, India is becoming a capital of cancer. Things are working or expanding so in a very big way. Every day we are hearing new cases of cancer, new types of cancer and stuff like that. So what are the hurdles in this, and how do you analyze and work on it on time so that you don't lose time and you don't lose any of the opportunity out there?
I think what you bring out is really right, that it is very fast paced. At the end of the day, technology is very fast paced. If you think about it, when I was growing up, there were no phones, and today we can't think of a world without a mobile phone. So that is how quickly technology is growing. So I think hurdles in terms of an AI company, first is understanding. I think hurdles anywhere first is the motivation to want to do something. As a startup, you have to be very committed, very focused, and have a vision of what you want to achieve. That is very important. And you need a team to do that. There is no way, if you think that I'm an entrepreneur and I'm going to do everything by myself, it can't happen. You have to have a team that is equally committed, equally focused, and shares that same vision of what you want to achieve. That's how a startup can be successful. And that is why, as I said, I'm the co-founder. I bring something completely different to the table. Our founder brings a lot of vision, etc. So I think it's the team that we bring together to achieve what we want to achieve, because individually you can't. So that is the first hurdle, is to accept that you need a team. And yes, it's great that you have the vision, you have all of that. So people always say that the biggest hurdle is financial hurdles. I don't completely agree with that, because I think money is something that comes, doesn't come, etc. I'm just reading a very interesting book called The Psychology of Money, and that really tells you that money is one part of it, but actually what really requires to drive a startup is vision. So the hurdles is more the vision, the want to do, and whether it's AI or anything, this is the common thing. Now where AI is concerned, yes, the market is changing very quickly. You have to be on the top of it. You have to introduce new things into it, for which again you need a team. Not everybody is innovative. But what is important from an AI perspective is to understand what you want to achieve. So if you have the problem question to say this is what I'm trying to solve, then you can work in reverse engineering to say how I'm going to solve this. and then you get AI, you get technology, you get people who know what they're doing in it, and that's how you can do it. So I think it works more sometimes to do it backwards. Yes, for example, same thing, if we go backwards, cancer is on the rise. People are getting diagnosed and dying with cancer very, at a very rampant stage. So that's why we are doing screening. So we have a healthier population who is the workforce of this country. We don't want to paralyze that. So if we can screen them to say whatever it is, then I think that makes sense.
And that's why we need more of these kind of startups out there, so that can be done on a larger scale.
Yeah, I think both AI is a spectrum and healthcare is a spectrum, and where you want to sit in that spectrum is very important. Healthcare is huge, from service to screening to diagnosis, and why cancer, for anything. There's another report that says that India has the highest amount of diabetes and blood pressure now, so even cardiovascular diseases are on the high. So cancer is what my interest is, but that doesn't mean everybody will be in that. So healthcare is huge, AI is huge. Any domain, any specialty within this field, I think has the same hurdles. It is not like fintech, it's not like another financial technologies, etc., where things move very fast. In healthcare, it sometimes is a little bit different because things may not move very fast. And things also move very fast. So it is very different from that perspective, and you have to understand the market that you're working in.
And like we talked about the basic hurdles when a AI-based healthcare company faces, if I have to talk about, because AI is based on all data. The
Correct.
more data you have, the more accuracy or the more operations that can be done.
Correct.
So, and there's, if we talk about data, there's this word comes with data is the privacy word.
Yeah.
So there's this challenge involved in it, right? So what do you think are the challenge specifically, or the confidentiality related to data privacy when the company collects data, they work on it, so how do they keep it going, move, work and maintain all those stuff? So what do you think a startup can face all those hurdles in that? Because I don't think people are much aware of it unless they do a great research on it.
No, you're absolutely right, Simran, that data privacy, data confidentiality is a huge thing and something we must acknowledge. There are rules and regulations globally for them. India is just starting to get into that regulatory space. So there are two parts of this. So there is an AI regulation which also now globally is coming into force. It is not there at the moment, but it's being discussed very widely. So that is one, because we want to see that how much AI is enabling, etc., and they want to have rules and regulations for that. That's not come as yet. When it comes to data privacy and confidentiality, as a company, if I can talk for myself, we always take consent from the employees before they share their data with us. You have to have certain ethics in terms of how you use the data, what you do with it, and you have to be very honest and open to the employees what we are going to do with their data, how we store it, how we save it. So we as a company are GDPR compliant, which is a very universal way of data protection and data confidentiality. There are other regulations as well, like HIPAA, which are used in different parts of the country. So we are GDPR compliant, which means that we will store data confidentially. For example, I'll give you a very simple example. When we collect the data, we don't take anybody's name, or we don't have anything that identifies them. We have gender, we have date of birth, but not necessarily their name, address, etc. We don't need it. There's no need for that. So we don't collect that. So that is for example, one of the ways in which we are showing data confidentiality. So yeah, we can tell you whether we have X number of males and females and what age group they fall into, but I can't point out a finger at anybody. So that is what we do from a data confidentiality perspective.
And what do you think a company would, should keep in mind or should be ready for these kind of steps to be taken?
Yeah, you're absolutely right. So what is important is that everybody understands the compliance that is required. So if you're working within India, it's very important to understand that what is confidentiality, what is privacy, what is consent. You must be aware of it. Your platform should comply with this, whether it is regulatorily needed in India or not at this point of time is a debate, but that doesn't mean you don't do it. Everybody has a right of consent to their own data that they hold, at the end of the day. So I think it's very important to be aware that these are the regulations that are out there in the market and how you can be compliant with them. There are lots. There is ISO, there is HIPAA, there is GDPR. Everything doesn't have to come with everything. You have to be understanding of what is required for whatever your company is doing.
So Neha, there is one more thing which comes with the startup or any of the company, that is the finance word. So, not. I don't think finance is something which everyone can understand or can take it forward. So, and there's a notion, the advanced company or business you have, the more money is required, the more financial support is required. And as of now, AI is one of the top leading sector which is involved in every other industry of our country, whether you call it education, healthcare, right, or the policies making, or any of it. Everything is involved or working with data. So what do you think the amount of finance required in terms of AI based healthcare? Is it more, less, medium, or how does the finance work in AI healthcare?
So finance is the biggest elephant in the room that we have to address. And again, as I said, this book that I've been reading, The Psychology of Money, really gives you a different perspective on how financial implications happen to anything. Okay, so I'll just give you an example. If me and you both have 100 rupees, we will both spend it very differently. I might not save anything out of it. You might save 50 rupees and spend 50, and that comes a lot from how a person is brought up, what is their understanding of money, in what era of life they have come. So for example, if somebody was struggling during COVID, they are likely to save the money, but somebody who made a lot of profits during COVID will be like, no, it's okay, I can spend it. So I think that comes a lot with how you have been. So as a bootstrap startup, having been a bootstrap startup rather, it's very important to understand where you spend the money and how much money is required. So 100 rupees can be too much for me, but it will be too little for you. So money is very open to say that what is right and what is wrong. There isn't a right and there isn't a wrong. It is how you develop your team, how smartly you work with money. Of course, in AI, some amount of money is definitely required because you need to invest in the technology that you're building. You need to, if you are not, like I come from a healthcare background, I'm not an engineer by background. So I need to have engineers in my team who will do the AI. I can bring the vision, but I don't have the I don't have the technical expertise to actually do it.
Yes.
So I need to get people who do it. So that is why, as I said before, also the team is important. And team for me is very important, not in terms of designation, but in terms of roles they play.
Yeah.
So as a co-founder, I play multiple roles. So same way my data science team, they are playing multiple roles. They do help with development, they help with AI sourcing, they help us with data, because they are committed and passionate to the same level that I am for the growth of this company. So that is very important. So financially, yes, there is no right or wrong. You can have $1 million and still fail. And it's okay to fail. It's absolutely okay to fail. That's not a criteria for passing or failing is not money. I mean, I think in India at the moment, the biggest example we have is byju's, who had so much during COVID, but they did not have the future vision that once COVID will end, everybody will go back to physical schools. I cannot have, if you have children, they cannot be on digital schools all their life. They have to, and very important to go to school because you learn social skills, which you cannot learn in front of a computer. So, and maybe byju's didn't invest wisely and whatever they are doing. So what happens is when people get a lot of funding, they try to hire all the top end, thinking ki we'll get a lot of business because we have top end. It doesn't work that way. It doesn't work that way. You need to be very smart on how you invest your money and what you are getting for that. So value of product is very important as compared to valuation of product.
I another have an added question to this while you were saying this, to answering my question. So if, let's say I'm a person who has a vision or an idea to a AI based healthcare company. So how do I pitch, or what should be the requirement if I'm going to an investor? See, this is my idea. So please tell me, how do I pitch in? And if I have to say कि मुझे कितना amount of exact money would be required or minimum should be required. So how will this go if I have to take that step?
So I think one thing is, Simran, it will be product to product. It's very hard to be generalized to say that it is this money or that money. It is depend on your product. It depends on a market need that is there for your product. So I'll give you an example. During COVID, everybody could take their saturation from a smartphone. That's the technology that came out. That came out during COVID because we had to do remote monitoring. There was nothing else we could have done. So people came up with that technologies ki, you scan your face or whatever and you can get your heart rate, blood pressure, saturation, everything. Everybody's doing that now. That the novelty of it is gone. But can you do something better in that? Can you say that actually I will check vitamins also in that if somebody has a vitamin D deficiency? So you're using the same AI algorithms but trying to check for different things. So that is how it can be different. So if I'm going to go to an investor and say that, yeah, with smartphone I'm going to check saturation, he will say another 100 people are doing it. What is your difference in that? So you have to stand out. It's very difficult. I'm not saying that it's an easy task to do, to think about how you are different. Maybe you want to approach a different market. Maybe you want to do it somewhere, I don't know, in the remote parts of Africa, for example, where there is nothing. But how do you get there? How do you source that? That becomes very different. So when you go to an investor, unfortunately, it doesn't come with a rule book to say that if you want this product, the money is this much. If you want this product, the money is this much. It's your idea. It's your passion. And most investors, in my opinion, also look at the founder themselves. How much vision, how much passion do they bring? Because you many times invest in the people and not in the product.
Yes.
And I think from personal experience, it has always been more profitable to invest in people than in the product. Because if you invest in the people, the product will come.
That's very well said. So, Dr. Neha, there's one more thing which you are dealing, or few of the people in this healthcare-based startup is dealing, but not everyone, right? So that is, I don't want to make it a kind of base of gender bias something, but yes, being a woman entrepreneur comes with its own challenges and hurdles. So that is always there, whether we agree or not. But in our subconscious mind, it is there, right? So what do you think a woman entrepreneur faces, and the type of hurdles they face, and this advice or this of your expert will be, should be the other women who wants to be in this sector,
Sure.
could help that?
You're absolutely right, Simran, but let's be honest, the paradigm is changing. Very slowly, but it's changing. We have a lot of women entrepreneurial platforms, and a lot of women are taking the entrepreneurial step as well. It goes back, if you took metaphorically, is the mindset. That's the first thing. Like if you go back to Sridevi's movie English Winglish, it was the mindset. She was an entrepreneur here selling laddus, but everybody thought of her as like, "Arey, ye to laddu bechti." The minute she goes to America, she gets a tag of being an entrepreneur because yeah, she makes them herself, she sells them herself, so she is an entrepreneur. So I think the first biggest hurdle we faced is mindset. And for me, mindset is not just what the world perceives, but also as a woman, what you perceive for yourself. If you have that self-confidence to say that, I am going to do this, then nobody can stop you. The world is open. And I think first hurdle is among ourselves. I agree, as a society we are very patriarchal, and not necessarily all women will get the help and support that they require, not just financially or professionally, but even personally from her family and friends that is required. So we are very good at criticizing people, but we are not very good at supporting people, especially women to women support is not really there. So I think as a woman entrepreneur, I salute everybody who wants to get into this journey. I think it's a big step. Believe in yourself is what is key. It's very hard. I'm not going to lie. It is hard because doubt comes when you are sitting in a male world and doing this. But if you are passionate, you know your product and you know what you're trying to do, then you have a leverage over anybody else and nobody can take that away from you. So I think as a woman in a man's world, but very gladly that it is changing. It is definitely changing. As you can see, we are two women here, one taking the interview and one giving the interview. So I think it is definitely changing, but hold on there, have faith, have belief, and I'm sure you can achieve.
Very well said. And this piece of advice, not only this, but all the questions you just answered us and to the audience will definitely be helpful for them. They will take this advice and they would be very grateful for this discussion that they just had, the insightful discussions we had.
Thank you so much for having me. It's my pleasure.
Thank you so much, Dr. Neha, for coming to the platform and sharing your experience and expertise.
Most welcome. Thank you.
Thank you.